I became this carer without really knowing I was a carer. I just was there, putting one foot in front of the other, trying to keep going to help my husband and fighting his corner for him. And it never occurred to me that there was any support for me.
Yeah.
And because I've got my own mental health condition, and stress is a trigger for that, and I just kind of disregarded it. I was just going to try to keep going and fight every day. And it wasn't until much later on that when the CPNs were involved that they said, well, what about you? Have you got support? And I thought, not really.
Yeah.
I got friends and family, but I had nothing. I had no official sort of support in place.
I think I've had like a bit of a mixed experience with sort of support from school or education, employment and stuff. My last job was surprisingly unsupportive, given the field of work I was in. I asked for time off. There's a procedure for it, but I've asked for time off quite quickly. And no one told me that there was such a thing as carers leave. They insisted that I took it all out of my annual leave, and then when I asked afterwards if I could sort of switch it around and give it back to me, they didn't do it. But then when I was at uni, they were really supportive. I had to come home for a month, and it was right at sort of deadline time, and they gave me extensions, and they were really...
That's really good to hear. It's kind of luck of the draw sometimes.
Yeah, it's a mixed bag, isn't it?
Yeah.
Yeah, a lot of time we don't think of us being affected by things. We keep working, we keep going to work, we do things when we come home, and everybody thinks we are fit.
Yeah.
So unless you collapse, then they will say you're sick. But I feel like that's why the support for us, I think as carers, are not there in the beginning. They let us get on with it and then wait till we reach the point where we can't do any more, and then they will come in to support us. But then it's too late. Sometimes it could be worse for us.
Yeah.
To support the other person.
Well, I think because of the mental health aspect as well, in the start when you talked about not considering yourself a carer, I didn't, because I wasn't associating it with the stuff that people do when caring for, say, somebody with dementia or somebody with a physical disability. And so when I saw at my GPs that there was a carers network, and I thought, well, that doesn't really apply to me. But actually, eventually I signed up for it, and they were good. They said, yes, we can do X, Y and Z for you, and make sure you get a flu jab, practical things like that, to make sure that my health was good, because I suppose my health needs to be good to look after him. So.
That's right, yeah. In the beginning, I didn't want to take help from other people and other family members, because I thought I would be looking as weak and not able to look after my own child. So I did not want to approach him in that way. Yeah. But then it came to a point, I said, well, if I don't get them involved, how far will I go? So I had to use a different strategy, for them to come and help. And they were very supportive, and that's helped a lot. And I realized that if you don't take help, if it's out there, then you are on your own, and it will not do any good to your health and your well-being yourself. So having the family or friends and networking with others has helped a lot, and I've seen the difference now.
I'm one of these people who insists on being incredibly independent and, I can cope with it all on my own. But when I told people what was going on, I think when people knew about it, they were so supportive, and it was an enormous source of help. It really was. And our families don't live locally, so it was quite a distance for them to travel to be with us, but they offered to if we needed that help. And just friends, being able to offload everything onto friends. So very good to just sit and talk, and they let me talk, they let me just pour everything out, and were really understanding, and a few of them have been through it as well and know what's going on.
I think as well, I think for me at least, I feel that by being able to talk to other people, friends, family, whatever, about what was going on to do with my mum's health, it's kind of made me more able to talk about everything else. You kind of sort of get rid of the...
More get you confident to talk to people.
Yeah, exactly. And I think that in that way it's kind of made me a lot more balanced, and that before, or for a long time anyway, I was quite an insular person. Still outgoing, but I just was never one to talk about problems or bad stuff. Yeah. And I think that by doing that, it kind of sort of paved the way, I suppose, to being able to talk about other things and being honest about how you feel about certain things, and because I think that's part of the problem, isn't it? If you hold everything in for too long.
Yes, we hold everything inside. We don't want people to know what's happening to us.